Good evening, and thank you, Darren, and thank you, Mayor and Council. Tom Gonzales, Public Health Director, Larimer County. I want to give an update that we did give at 11 o'clock to our elected and appointed officials as well as the school districts. First is an update on our 2 daily indicators that we use really as our triggers for COVID-19. And the first one is around positive cases. We now have 422 positive cases in Larimer County with 19 deaths. We are currently averaging about 8 to 12 new positive cases a day, and we do have 6 facilities with an outbreak. That's long-term care, and I did want to talk a little bit about that. And Larimer County was the first county, unfortunately, to have an outbreak in a long-term care facility. And that was day one. That was our first and second to cases. And many of our long-term care facilities, this is scary. This is scary times because this virus reacts very differently in those situations and those people that are much more susceptible. But we were fortunate enough to get the Centers for Disease Control here on day 3, the State Health Department, my staff, and the great work from our long-term care facilities. And the first one was Columbine Health Systems. They saved lives. That's the bottom line of it. They've saved lots of lives. And it's hard work. It's scary work. And I know those that have loved ones in these facilities, it's scary. And I just want to give that shout out that those outbreaks continue, but we're monitoring them and we are slowing the spread drastically. So that's a big item we look at is these outbreaks. And big other item we look at is major medical facility health. Currently, our hospitals are treating 43 COVID positives. That is slightly down from over the weekend of 48. So that is some encouraging news. We are now tracking COVID new hospital admissions. That was an idea from Commissioner Steve Johnson, which is a great idea. Back on May 10th, we had a high number of 10 new COVID positives in our hospitals. But good news on that day, we had 9 people discharged from the hospital, had been treated, and they were recovering. So there was a good balance there. We only had 1 additional in the hospital that day. So we're really tracking what's coming in and what's going out. And I'll tell you, the hospitals are doing some great work. You had UC Health and Banner, both Margot and Kevin on the phone. Amazing work they're doing, saving lives and learning how to effectively treat this disease without real treatment or a vaccine. We on April 29th had 8 enter the hospital, and then Thursday 5, and today 5. But again, we've been stable on the total number of COVID positives in the hospital. ICU beds, that's another one we really look at because this follows kind of that SARS, that sudden acute respiratory syndrome. So immediately folks need to be put into ICU and cared for in that urgent setting. Good news, currently 48 beds down from 52 on ICU. So we're using about 50% of our ICU beds in Larimer County. That's been up and down. That's a better number than we've seen in the past. Our ventilators in use, and you heard from Kevin Unger, a ventilator isn't a ventilator isn't a ventilator. So it depends on the person and in the stages of the disease, what ventilator they receive. But we are currently at 48. That's down from 52 as well. So some more encouraging signs as we look at our hospital health. I said that wrong. I jumped back up to ICU beds. I'm trying to read this twice. So we're actually slightly down 43 to 36 with ventilators. So that's 43 to 36. 54% of our ventilators are in use as of today. We watch Weld Hospital System very closely because we are tied together both with Banner and UC Health. And some kind of concerning news out of UC Health in Greeley. They're really at capacity. It's a smaller hospital, but pretty much all 54 beds are occupied. However, Banner in Greeley is much better position. It's a much bigger hospital, but they're way less in capacity, well under 50%. So that's some encouraging news there as well. Now, one of the big items I have been talking about is testing. And we're talking about acute PCR testing. And I've been saying we needed to ramp that up. And it was rather frustrating about 3 weeks ago. And we've been saying we need to be able to test every symptomatic individual quickly. That's one of the 5 indicators being used to move into the safer at home. And we're starting to see that increase in testing pickup. With the help of UC Health, Banner, Salute, and others, as well as our own community-wide testing in partnership with Colorado State University. I was out there today at one of our community-wide tests at CSU. Wonderful setup with tents and protective gear. It's a drive-through testing facility, so there's really no exposure. We are able to now start really opening up the doors on testing. Now, what that does for us, that we're able to identify a positive person immediately and do what we call contact tracing. And that is really, really key into minimizing the spread of the disease. And I also add, when I met with you, the council last, I was kind of frustrated. It was taking us about 7 days to get test results back. We're now getting them back in 24 hours. That's great work to our state health department, the resources coming from the governor's office. They have really changed the time frame and the ramping of our testing. So that is incredible news, because as soon as we get that positive within 24 hours, our goal is to issue isolation orders and discuss that with the individual that's positive within 6 hours. And then we do our contact tracing and get anybody that has close contacts, and then issue quarantine orders. And that's key. The goal here is to get people that are ill or may be ill at home, letting the others that aren't out to start getting our businesses reopened. That's really, really key. What I'd like to say is, for the safer at home phase, we modified our case investigation and contact tracing process. We flipped it upside down and looked at every which way we could improve the process. And my staff have done an amazing job. They really did some increasing of staff. We've got some more paid volunteers out of Colorado State University, School of Public Health, Department of Environmental Health, former employees, people that have done this work before. They're helping us out. We've got a team of around 30 that are helping us. Now, when I say 30, we're doing this 7 days a week for 10 hours a day. So 30 sounds like a lot, but when you're operating that big, it's still a toll on the folks, because all the interviews they have to do. But we're excited to say that we're able to get those isolation orders out in a timely manner. The quarantine orders, it's taken us in some cases up to 72 hours. Our goal is within 24 hours, so we're improving there. We are looking at technology that can assist us with that, and the state health department's helping us with some of that technology effort. So I'm excited on where we're going there. We're not completely there yet, but I'm thinking we'll be there very quickly. As we ramp up testing, we'll ramp up our case contact and monitoring. Now, you may have heard folks talking about a variance. You can apply for a variance from the state's safer at home order. One thing to note before going into these is that we will really not see the impacts of the safer at home order for about 10 to 14 days from when they're fully lifted and when we're stepping down, because that's the incubation period on the average, about 5 to 8 days, with the outermost being 14 days. So we're monitoring the hospital health, we're monitoring the amount of tests, but more likely than not, what are we, Tuesday today? Probably Sunday, Monday is where we're really going to want to gauge where we're at. And let's just hope there's not a surge. But I think here in Larimer County, we're doing a great job with social distancing, with businesses working their heinies off to make it safe. The face coverings, we've both issued orders there. I think those are all efforts to continue to keep the spread of COVID virus low. And then it's important that those susceptible population, 65 and older, and those with underlying health conditions, primarily diabetes, heart disease, and lung disease, it's still stay at home. And that's difficult, but we need to look out for those individuals and assist those individuals, because they're the ones where it gets really serious and they end up in the hospital with some serious complications. But as we move forward, we're working on early warning indicators. Those are those triggers to reinstate emergency response measures. And those indicators include what I just was reading you, that we're looking at daily. It's the new COVID-19 positive admissions to the hospitals. Well, where's the limit? If we're getting 8 to 10 a day, but eight or nine are being discharged from the hospital, that the hospitals can manage that. So we're working really closely with UC Health and Banner and Estes Park Health on what is that trigger. If you got 30 in one day, would that be a surge? So we're working on that and having those conversations. Then the number of COVID patients in the hospital. I said we're averaging around 40 to 45 to 48. Well, what's the trigger? 60, 70? What happens? Where is there a surge? So that we're developing that as well. And then the number of COVID positive cases countywide. Now, anybody would assume if we're doing more testing, which we are, leaps and bounds more, we're going to get more positives, which we are. So unfortunately, I still don't get the results, all tests. I don't get the negatives. For whatever reason, I still can't get them. I've been begging and pleading from the state health department to get those, but we're not. So I don't have a denominator. So I can't give you a percentage positive versus negative. So we just have to go with positive, which isn't the greatest epidemiological way of doing things, but that's about best we have. And again, we're averaging 12 to 15 new cases a day. So if all of a sudden we got 50 in one day, would that be a trigger? So we're looking at that as well. And then definitely just overall hospital census rates, both total and ICU. And along with that, we're working on a suppression plan with the hospitals that provides information on how Larimer County intends to monitor and control the spread of COVID-19. That's an important piece. And we've got a draft plan that's being really picked apart by our medical director, by the hospitals that are getting involved in this and providing lots of feedback. And where we need to get that information in that plan. And parts of the plan where we're saying Larimer's doing things is we are very tied to an emergency operations center. We're following incident command system, which that drives how we do logistics, planning, and operations. And we very much appreciate Fort Collins being heavily involved in the EOC. You have a liaison member that reports twice a day to us. That is very important. So thank you for your support with that. As we increase our testing operation capacity, that's a part of the plan. Public information management education. I pledge to work with Darren and Travis up in Estes Park on face coverings education. I think there's a lot of work to be done there on what that means. How do you use them? Why are we using them? Those kind of things. So we're going to be working on that. Logistics support and supply chain monitoring. We got to make sure our PPE is being filtered to our hospitals and our long-term care facilities, nursing homes. They need to have the right gear to protect themselves and others. And we're continuing to improve that as well. The alternate care site at the ranch, that's a jewel. That's a gem that's going to be in our suppression plan, because hopefully we'll have 200 to 800 hospital beds available when unfortunately a surge comes, and that could be more in the fall. We don't know. We're trying to figure that out. But that is certainly a jewel that we can have as part of our plan that we have. If the hospitals, for whatever reason, met a big surge, we have the ranch there as well. Compliance, there's a part that we've got to get compliance. And luckily, living in Larimer County, we tend to get good voluntary compliance. So it's more around education and working with our businesses in the community on what we're asking them to do. And we're asking them to do a lot. And some people are confused. And so that's part of that compliance. And then lastly, which is one of the most important parts, the disease surveillance and infection control. That's that contact tracing piece. We keep ramping that up. We keep improving there. We can then make sure those that are sick are at home. Those that are not are out working and contributing to the great work here in Larimer County. And the biggest piece, the challenge with this virus, as I've been saying early on in April, is asymptomatic spread. So it's anywhere from 25 to 40% of our population that gets the virus, mainly the young and healthy. They may not even show a symptom, but they're spreading it through the respiratory droplets. That's why the face coverings are so important, because the face coverings protect other people, not the person. But if somebody is ill, or they've got the virus and they're asymptomatic, and they go visit a business and they don't have a face mask on, they are now putting others at risk, including the workers. So that's the big piece when you're talking about this virus, is that asymptomatic piece. So we really want to ramp up testing to be testing all asymptomatic people that have been near a high-risk COVID positive case. So that'll be something we're going to be ramping up as well. So let me see. I think that's my update, and I'm certainly open for any questions or comments.
But I'll start off, and I really appreciate what you're doing, and I think it's important to tell the whole story. You know, we're getting a number of emails, about half and half, basically, some very complimentary of facial coverings right now, and about half that are not supportive for various reasons of facial coverings. But just to put it in perspective, the Safer at Home directed by the governor, and then as it comes to the county, those decisions are made. So we're really in a step down portion, as you mentioned, from the stay at home. And that's an important part. And that's why the facial coverings now come into being very important, as you mentioned, for the asymptomatic. I saw one graphic, and I don't know the source of it, but I'd like to maybe have it verified, but it really had a person that tested positive wearing a mask, and then to someone that was not infected, and there was about a 70% chance through that mask. But if the other person was also wearing a mask, it dropped to about 1%. And then a number of folks cite the Surgeon General in early March, when this is before we were even having major conversations about staying in place, and saying how masks weren't effective. And I think it was in the context of what was happening at the time, and not really dealing with it in the situation that we are right now. And so I think one of the important parts is helping people understand that we are in a step down. People are emerging more for various reasons, and opening businesses and monitoring at the door and so forth with temperature, and as well as with facial coverings. And it's for that reason, it's in protection of those that might be not showing symptoms, transmitting that to someone that hasn't acquired the virus yet. And so it's in this stepping down phase that's so important. And if you would just talk about the time durations of these executive orders and the durations, because some people assume that this is in perpetuity. Well, if the virus surges again, they talk about the second wave, and what we're trying to do is exactly what Larimer County and Fort Collins residents have been doing, and that is taking the precautions necessary to keep infected and those that potentially lead to death at minimal at this point. And that's why we're doing this sort of thing. And it's not that the game's over. We're in the first quarter, and that's why we have to take these precautions now. And if we can develop the capacity and testing and so forth, that's why we're doing these things. Would you concur with that general assessment?
Oh, absolutely. You use the analogy of a football game, first quarter. And during the game, the coaches make changes, right? During what's going on with the game. And that's exactly what's going on here. 2 months ago, it was different. We didn't really understand the asymptomatic piece of this virus. And as soon as we learned about that on April 4th, CDC and our Surgeon General, our doctor, the USA doctor, made a change. And it was the right change. I'm trying to digest all the information, and most of them is showing that, good 70% plus reduction. And again, it's more the asymptomatic. And I get it. I'm getting the emails and calls too, and they are about 50-50. And I think the biggest concern, Wade and counsel, is people feel like some of their freedoms are taken away. And I, as an American, and I wholeheartedly believe in our Constitution, we don't want to be taking freedoms away. I want to give back freedoms. So if we do this hard work, it's sacrifice. I got my face covering, and I got to wash it once a day, and there's some steps I got to do. Well, our goal is to be able to step down quicker. I got to remind everybody that the large majority of this state is still at stay at home. Our counties south of us, they're still stay at home till May 8th. We were able to start stepping down earlier, and that's because of the hard work. And I know it's hard to feel that and see that right in the middle of this event, but we're a couple weeks ahead of those counties, and we're going to be going ahead further. We can keep that hospital health, at 40 so in the hospital. We can start stepping down even more, and I will not be afraid to go to my Board of Health and to the hospital and say, hey, I think we can open up a little bit more. I think we can do that here in Larimer because folks are listening and they're doing the right work. And I think that's key. I agree. This is early on. I believe I heard this is a marathon. You know, I've only ran a half marathon, and that was quite troubling after that. But we're on a marathon run here, and we're in the first few miles of it. And it's really going to be the new norm until we have a vaccine. And even my wife asked me, and she says, my goodness, we got to wait till a vaccine. I said, yeah, things won't be the same until we have a vaccine. Now, so every day may change a little bit, and hopefully we can get a little bit larger groups. We can start having those, more normal occurrences, but not for a while, and certainly not until we have a vaccine. So I agree with you. The first step for us is really the businesses. Well, I'll tell you, the businesses, they've taken a lot here and sacrificed so much, and I get it. And we've got to really put effort and really get the education in our businesses. So our Workforce Development Center is working with a variety of the industry, including our restaurants, to look at creating task force to hear from them. How can they slowly start reopening for dine-in or our theaters or whatever it is, bowling alleys? How can they start slowly opening up and following these new norm measures? And we want to hear from them. I think it's more innovative and creative when we hear from the industry, the people. So that's the first piece. So we're hearing from them. We're providing them education. We were able to get a little small grant from the Colorado Health Institute. So we're making tons of posters and copies for the businesses that talk about 6-foot social distancing, face coverings, those things, so they can put them on their storefront. So when customers come up, they can see that information. So that's key right now. We've been putting a lot of emphasis in the businesses, and we want to continue to hear from them, and we want to continue to support them as they start reopening. I think next, absolutely, it's our general public. Tons of confusion around the face coverings. And it dawned on me easily earlier that we really got to work on education. And I would like to extend Fort Collins has 50% of the population in Larimer County, roughly. Extend a hand to you, Council, and Darren, and then up to Estes Park, where they've got an ordinance as well. Maybe we can work on ways that we can really get some good media campaigning and education campaigning out there, so to clearly get our talking points and messaging out to the community. So I'm open to thoughts and ideas. We've got some wonderful creative PIOs on all three of our staffs. I think we put them together, we can get some great ideas and great work out of that.
Tom, I appreciate the discussion that you made about trying to figure out the statistical early warning signals. The hospital admissions is a trailing indicator. By the time hospital admissions go up, we've already got a problem. So I'm curious if you have an estimated timeline for when those are going to become available. It seems to me that having some leading indicators would help us make better decisions about are we on the right track? Could we even relax the restrictions a bit more, or do we need to tighten them down again? So I know you don't have them now, but I'm curious if you have an estimate for the timeline for getting those leading indicators.
And you're right, those are more tail end, and we're trying to get more upstream. That's the word we use in public health. Indicators and tests can be part of that. Also through our monitoring group and our case tracing, one trend we're seeing is because of the stay-at-home orders, because of folks really complying, when we get a positive, it's a lot less more contacts that have had that close counter than before. So that could be an indicator too. If we're still, I've only been around 3 or 4 people because I've been staying at home, I've been following these orders, versus 20 like it was before the stay-at-home order, that could be an indicator as well. So that we're trying to be creative and use ways that we haven't before. But my goal is to have the suppression plan and the early warning indicators to the hospitals for their review and approval by early next week. And yeah, actually one of the parts that we revamped with that group about a week and a half ago was just that. We now have 3 kind of levels when we're interviewing the case, and we put them in either they were in a high risk, such as they're a healthcare provider or they're a long-term or skilled nurse. And then we've got some other ones. Some essential businesses, they are higher risk versus medium and low, somebody that maybe is staying at home right now. So yes, we are now getting that information clearly, and we have clear defined categories. And what's important about that is any of the high and medium risk, definitely the high, we have to do the complete contact tracing. The lists have to be completely done with quarantine orders because that's a high risk. Versus low risk, which I was at home around my family or my friends, just these two close friends. So yes, I failed to mention that in my update, but that's something that we put together, and I think that's helping us prioritize who we definitely give orders to versus the ones that we're working on. So I think that's an important piece.
Tom, thank you very much. And we want to keep on the trajectory where we keep the positive cases down, and that would lead to less deaths. And therefore, the physical distancing of 6 feet so important. The facial coverings, the hand in hand with the ability to step down. And really, it's not about me individually. It's about those that we come in contact with, and that's where this has to work and work well. And then the groups of 10 or less, and then always be cognizant of the vulnerable populations. And when we're out, we never know if someone is in a vulnerable population because we don't know their medical history and so forth. So all those things are so important. And as you pointed out too, the asymptomatic aspect of this is critical. And so that's where I really applaud the people of Fort Collins in doing this. And that's why we want to work with you, Tom, and do the things that can have the kind of the right positive impacts on our communities.